Hey everyone, this is Dr. Dane with your Into Health video tip of the week. And this week I want to talk to you about your symptoms. One of the things that we do when a new patient presents to our office, and I'm looking at a re-exam that I did today on a patient that presented to our office 3 months ago, we generally do our first re-exam with our patients where we retest everything that we're taking care of about 3 months after they start with us. But when they initially start with us, we have them fill out something we call an MSQ. It stands for Medical Symptom Questionnaire. And it goes through literally a laundry list of symptoms they may be experiencing in their body. Each of those symptoms are clustered into organ systems. So for example, we have symptoms related to their digestion, symptoms related to their energy level, symptoms related to their weight, their emotions, their mind, their joints and muscles, their skin, their nose, their ears, their eyes, their head, their mouth and throat. So all different symptoms, and they rate themselves on those symptoms. So if they don't have the symptom at all, they simply skip it. If they have the symptom, they rate it from 1 to 4. 1 would be that they only occasionally get it and the effect of the symptom is not very severe, where 4 would be they frequently get it and the effect of the symptom is severe. And then we have them total up all those numbers. We like to see the 0, obviously, if you're not getting any symptoms, that your body is healthy. It doesn't always mean that there's nothing wrong. It just means that you're not expressing that, right? But if they have a high score, like over 50, that tells me that that person is suffering with a lot of symptoms. So this patient, after the 3 months of care, initially their MSQ was a 52 and it went down to a 19. So their body is expressing less symptoms, and that means that their body is functioning better. So remember the law of cause and effect. For every action, there's an equal and opposite reaction, right? That's the law of cause and effect. We treat effects with our healthcare delivery system most of the time. That would be drugs and surgery. And I always make the analogy of the oil light in your car comes on, and instead of really putting oil in there, checking to see what's really wrong, or your check engine light comes on, you just put a piece of tape over it, right? Or you take the bulb to that little warning signal and you just turn it off. That's what we do in America a lot of the times. We're treating the symptoms, but we're not really looking at the underlying physiological problem that's driving that symptom. So for example, you may have high blood pressure because you're overweight, you don't exercise, you're under a tremendous amount of stress. So instead of addressing those underlying causes, you're just taking a blood pressure medication. So I really try to encourage my patients to look at the symptoms in their body as signs that there's an underlying physiological problem. And we got to figure out where that physiological problem is coming from. And hopefully that's the way you take care of yourself as well with your doctors. Remember, it's great to have a sick care doctor when you get sick, but it's better to have a doctor that's really going to dig under the hood and see what's going on with that symptom and why you're getting it. So this is Dr. Dane with your Into Health video tip of the week. Hope you guys are having a great holiday season, and we will talk to you next week.